It goes like this. Her arms across her breast she laid. She was more fair than words can say. Barefooted came the beggar maid. Before the king Kafutua, in robe and crown the king stepped down to meet and greet her on her way. It is no wonder, says the Lord, she is more beautiful than they. As shines the moon in clouded skies, she in her poor attire was seen. One praised her uncle, one her eyes, one her dark hair and lovesome mien. So sweet a face, such angel grace, in all that land had never been. Kafetua swore a royal oath, this beggar maid shall be my queen. And this is the end of the poem here.
Wow, this is actually very educative, and I'm really inspired. Definitely, I'm very inspired. And yes, Eternal, tell me, what did you learn from this poem?
Well, VM, it was a very nice poem, and thank you very much for it. Very well read. I think I'd like to hear it again before the end of the show, if that's all right, and comment on it properly.
Definitely. Yes, high time for me to introduce the man inside the back, the cat inside the back. So it's time for me to open and release him live. Please, gentlemen, kindly introduce yourself and tell us where you come from, the school you were, and what you are doing as a professional. So you're welcome.
Thank you very much, VM The Voice. Thank you very much for having me today in the morning. Thank you very much. I'm indeed glad to be here today to say about my little experience. Anyway, Muhammad Ali Ubari are my names. I live in Medina. I attended Jamsa Primary School, later shifted to the upper basic school, and finally I ended up at Misra Senior Secondary School. Currently I am in the School of Nursing and Midwifery in my 4th year studying nursing as a RN. Thank you very much.
Okay, as a nurse, it's very important to be a nurse in the Gambia. Are you actually a Gambian?
Yes, I am a Gambian.
Which part of Gambia were you born?
I was born in the Gambia. I was born in Brikama here.
Brikama?
Yes.
Brikama Health Center?
No.
Where?
In Dawakunda.
Dawakunda, that's fine. You said you are a registered nurse, that is RN, right?
Yes.
And tell us exactly what does it actually means to become a nurse, and being a nurse by profession, what does it actually means to you?
Okay, well, nursing generally means caregiving, you understand? Yeah, it is definitely we classify nursing as caregivers. Nurses are caregivers. So we can brief nursing to be the protection and the promotion and the optimization of health. You understand? That is generally what we know as a nurse, and it is a noble profession that many people look onto because they are caregivers.
Okay, when you talk about caregivers, my mother is one of the caregivers.
Yes.
You understand? My mother is one of the caregiver I know, and I know every mother could be a nurse, like you're saying. But when you come when it comes nursing as a profession, what does it actually mean deeply? I want you to explain that to the people.
Okay, deeply in nursing, we can class. If we are going to look at in-depth meaning of nursing, we are going to quote from Florence Nightingale. She is the mother of nursing, the modern day nursing. She is the mother. Well, this woman is the mother of nursing who have who have spent all her life helping people, building university for nursing, and making it so that nurses are respected, nurses are well trained, and nurses' voice are heard in the world. So generally, nursing, like to put it into a brief case, is the promotion, protection, and the optimization of health. So if you are going to define health according to WHO terms, we are going to define as a state of complete physical, mental, spiritual, and social well-being of an individual, and not merely the absence of disease or infirmity. So that's it.
Okay, that's interesting. I'm happy to hear that that brief explanation. I never knew that we have a mother, and in fact, the word nursing, I never knew that it's from a mother. But today I have learned. You being a nurse in the Gambia, how did you see yourself interacting with the patients, and then interacting yourself with the patients at Brikama Hospital?
Okay. Looking at the definition of nursing, since we were young, we were nursed by our mothers. So there comes a time in a human being when you feel sick, you understand? you will not be able to do anything. Sometimes you cannot be able to do anything by yourself. So you will be cared by nurses. That's why I always term nurses as a living parent. Even though your mother passed away or your father passed away, I believe in myself that there is someone who is your parent, and that person is the nurse, because he's the caregiver. One day or the other, if you cannot do anything by yourself, he is the one who is going to nurse you. You understand? He's the one who is going to take care of you, make sure that your needs are met, and that person can also be like a voice. That person can raise your voice up, because generally nursing, what people think about nursing is different. They only think that nurses work in the hospital, but no, instead nurses act as the voice of the patients. You understand? When patients cannot speak for themselves, instead nurses used to go and help them. You understand? They used to sit with this high diplomat, telling them that this is what our patients need, these are what we need, so we have to provide this thing for them, not only to care for them in the hospital, but also to make sure that their voice are heard at the lower level, at the higher level rather.
I'm actually inspired, definitely. But most of Gambian nurses, when you look at them very well, you come to realize that they are not even nurses. When I say they are not nurses, they love to become fashionable.
Yes.
You understand? They love to become fashionable. And most of these nurses, becoming a nurse, you need to wear these white clothes, and once you wear that, you are a nurse. Can you please clear that point to the people, because we have seen some nurses being idle in the hospitals, idling around in the market, idling around, insulting patients. So how do you classify those kind of nurse?
Okay, VM, that's a very nice question to answer. Not everybody in the hospital is a nurse. You understand? And nurses itself has different cadres, starting from the nurse attendant level, shifting it up to the community health nurses, to the enrolled nurses, to the RN, and finally to the BSc. You understand? So not everybody in the hospital who wear white things is a nurse. You understand? As a nurse, it is unethical to be rude to your patients. It is unethical for you to dress in a short skirt form to attract your patients rather. So nurses is bounded by ethics. So these ethics are to be respected as given by our mother, that is Florence Nightingale. You understand? So though many people used to term some nurses like, I go to the hospital, these people are rude to me, not like that. A trained and an ethical nurse, I believe every trained nurse is an ethical nurse, because this is the first thing that they used to teach you about. You understand? It is about the ethics of nurses. You understand? They used to teach you how to be ethical to your patients. You have to be in the shoe of your patient in order to hear the complaint from your patient. If you are rude to your patient, you will not be able to know anything about the patient. Instead, you have to bring yourself down to earth, listen to the patient's need. Some patients are there, they used to come to the hospital, like not only because they are sick. Not everybody that comes to the hospital is sick. Some are clients. They need some psychological, psychological
advice.
Yeah. So those people used to come, but it's like when you are rude to them or you don't show them that you are open, they will not be able to give what is in them. So instead, you have to be in their shoes. You understand? To listen to what they used to.
At your age, how old are you?
I am 19.
You are 19. Okay, I have seen 39 years old lady, and I also seen 29 old years lady being rude. Most of the time, this rudeness comes from ladies, females. They are well known because sometimes they don't know how to talk to their patients.
Yes.
And I have also realized seen a nurse shouting upon a patient, and eventually that affects that particular patient. Do you think that is right, and why?
No, that is not right.
Why?
It is not right. As I tell you, it is unethical. Like, I personally know that there are many nurses that are unethical, some nurses that are unethical. But I believe in myself that anybody who is trained, and you believe that you are trained as a nurse, you must not be unethical. You understand? Instead, you must be ethical to your patients so that they can give you what is in them. So imagine someone leave his mother at home, did not explain the problems to his mother, but instead he rushed to the hospital and see you. You understand? That only is a plus to you, because he or she believes that you will be the person who can be able to support, yes, like all the psychological needs or anything. So only this fact can even, like, if you are someone who is trained about it, who is ethical about it, you must know that, like, the ethics of nursing in general, you understand. You must bring yourself down. You understand? Listen to your patient. You should not shout. Anybody who shouts to a nurse shouts to a patient, that is unethical.
Okay.
Yes.
And what is your greatest experience being a nurse? And you told me that becoming a nurse is not actually easy. You know, on the other hand, it is very easy. Okay, you choose it as you choose it as you know, as something that as a passion. And now we are there. You are at Brikama Hospital. You are working there. What is your greatest experience you have ever experienced working with your patients, and then, you know, community leaders, you know, to the children and other stuff? What is your greatest experience?
Yes, I have numerous experience about it, because every day that I go to the hospital, you know, someone will be coming crying, but I'll make sure that that person ends up going smiling. You understand? This only is an experience to me. You know, some people used to, like, I used to meet with many people on the way telling me, oh, this was the nurse that took care of me.
Yeah.
Yeah, I am proud of you, and you are always there. I will look forward to you. You understand? I used to see many people who used to come by my way, greeting me, people that I don't even know, telling me you took care of my mother. That only is a plus to me. You understand? Those are all wonderful memories that I will have about, and those are the experience, especially with kids. You know, with kids it is interesting, because some kids used to come there, like as you used to do.
Yeah.
Your home kids FM. You make sure that any kid that is who's not feeling well, you bring that person to the hospital. Wow, that is great of you. And thank you very much.
Thank
for
you.
That. Yeah.
And what is your name again, please?
I am Mamadou Ali Bari.
Modu, you know, I'm proud of you simply because you have hope and you believe that nothing is impossible.
Possible, yeah.
Okay. Another question that I have, that many nurses also believe that, you know, in the Gambia, mosquito is everywhere, and now we are in the season of, you know, malaria and other stuff. Sometimes some people will be sick, and they will have fever. You know, they will have a lot of complaining about vomiting. Are you trying to tell me that all fever and all kind of vomit are sign of malaria?
Yes, fever is a sign of it's a clinical manifestation of malaria. But like looking broad about malaria, is a mosquito-borne infection. You understand? A disease caused by the infected female anopheles mosquitoes. You understand?
Are you trying to tell me infected?
Infected, not all female mosquitoes used to. You know, these nurses, like, they have the characteristic of storing these things, the sporocytes in them, that is in the saliva. Yeah, the difference between the female anophele nurse and the female anophele mosquito and the male is that of a different. That is, the female anophele mosquito feed on blood. You understand?
Okay.
While the male feed on nectar and other things different from blood. So not all female anophele mosquitoes, only infected female anophele mosquitoes can transmit the plasmodium.
Okay.
Yes.
And yes, listeners, if you wish to be part of the talk show, you can text into 3699555. We are going to ask questions about some of what you said here.
Yes.
You know, tuberculosis, all these are diseases. Can you tell me how can people be prevented from tuberculosis? You know, tuberculosis, please.
Yes. For tuberculosis, is an airborne disease. Yes, caused by the Mycobacterium tuberculosis. It is an airborne disease. Generally, everybody in us here has the TB bacteria in us. But the problem why it is not showing sign is because of the immune system. Generally, everybody have the TB bacteria inside.
What, even me?
Even
oh,
you.
No.
In a case when your immune system is depressed, you will start to show the clinical signs of the infection.
Okay.
Yes.
Now, listeners, if you wish to be part of the talk show, the number is 6999130. You can also call into 69992699555. We will go into short musical break. But before we go, you mentioned something which is very important. You talk about malaria, you talk about tuberculosis. Now, what about fungal infections too?
Yes, fungal infections, it's caused by fungi generally. Like we have the kinds of like this eczema that is like locally called this sansambaram that we have in our face. These are all fungal infection that we have. So it can be managed as well. It can be managed medically by using some drugs like ketoconazoles and fluconazole. These are all antifungal medications that someone can use to get rid of the fungal infection.
Yeah. So all these are diseases that affect us during the rainy season.
Yes.
Now, what are the advices and how do you think people can be prevented from these three sicknesses that are actually affecting us? That is malaria, tuberculosis, fungal infections. Because sometimes when you look at people food on their between their food, you come to realize that they have fungals, and sometimes some people in their hands, you come to see that they have fungals in their hands. So how do you think they can be prevented?
Okay. Yes, I would like to buttress a little bit on this malaria because we are on the season of it. Generally, you see this malaria, like when the female anopheles mosquito pees into your skin, the plasmodium is transported into your liver. So this thing is going to spend time there about 8 to 30 days. Like remember, it is not only in the first 8 days that you show the signs. Even when you go to the hospital, you do the rapid diagnostic test. Maybe if you can check on your prescription, most of them you see refer for RDT. You understand? So mostly if you go within the first 5 days of it, you will find that it is negative. But after when you come back for the in next 3 days, you will see to it that it is positive. Why? Because it is going into the liver to multiply. That it's a very stubborn plasmodium. You understand? It will go to the liver and spend time there for about 8 to 30 days. So when it spends time there, it is going to multiply. So malaria definitely is a killer disease. Why do we say it is a killer disease? Because of these three conditions. That is anemic, it causes anemic, it causes hypoglycemia, and it causes dehydration. So when it spends time in your liver, because you know, if you look down to our sciences, we tend to understand that these liver store important minerals like sugar, you understand? So this plasmodium is going to feed on that sugar that your liver store, and hence it is going to create a condition called the hypoglycemia, that is like having low sugar level body in your body. So that only can cause death, you understand? So malaria can also attack your red blood cells, you understand, destroying them, infecting them. So you know red blood cells are the major transporters of oxygen in the body. So when it infects your red blood cell, and the HB level, you understand about the HB, that is the hemoglobin level. That's what they test in the hospital for your HB. So you understand, by destroying that thing, you understand, looking at the word anemic, is having like a concentration of the hemoglobin below its normal. So it will infect those red blood cells, and hence you will become anemic. So if you are anemic, means that your red blood cells that used to transport oxygen, when they are destroyed, means there will be no oxygen circulation in your body. And
eventually you become
you die.
Okay. And when you look at it, some people also some people before they come to the hospital, they will drink paracetamol before coming to the hospital in order to reduce to reduce fever. But when they come, some of these people have malaria. But coming to look at it, when you refer them for them to go and test RDT, or maybe HB for their blood pressure and other stuff, you come to realize that the RDT will be negative instead of being positive. So what would be the advice to the general people, especially to the people that are having the infection or that are sick of malaria? Before coming to the hospital, what do you think the patient should do? Should they drink any kind of medicines before coming to the hospital? Yes, this is my question.
Yes, that is a very interesting question. Like people tend to take medication that are unprescribed at home, and that is dangerous. Yes, you understand. Looking at PCM, that, like as you say, that is the paracetamol. It's an antipyretic and analgesic. Antipyretic means it reduces fever. Analgesic means it is a painkiller. You understand? So taking too much paracetamol, like being used to it, the body is designed in such a way that it has its own resistance. When you are always taking paracetamol, you understand, your body will develop a resistant form in your body. Like it will be resistant. You understand? When your body is used to it, it will create a condition like a medium in which to be resistant to paracetamol. So when you come to the hospital, they give you back paracetamol. You tend to see that yes, this nurse or doctor gave me paracetamol, but it is not working. Not knowing that it was your fault because you have been taking the paracetamol, so your body have built up a resistance against that particular medication.
Okay.
So anybody who is sick, you understand, you don't understand yourself, you feel fever, you have fever, you vomit, you understand, any unusual thing that you feel, just come to the hospital.
Okay.
Yes.
Yes. I would love to ask these questions to the audience. Instead of visiting, the hospital, instead of going to the hospital, they'll go directly to the pharmacy, and eventually their sickness will not be healed. What do you think could be the cause of that?
Yes, I believe that most of them think that by going to the pharmacy, things can be easy and convenient. Maybe they believe that when they go to the hospital, the queue might be long, so they will not have the patience to see. And remember, it is your health. You understand?
Okay.
So you have to.
We have lost the first caller anyway. The number to call is 6991 555 699 555. I think it's our phone. Okay. Maybe the number to call is. You can also try. I will give you that number. You can proceed. Let me try to work on this other one.
Okay. Yes, they believe that when they go to the pharmacies, it is easy. You understand? It is convenient. They will not spend much time because they will use their money to buy medication. Remember, the person in the pharmacy, he's not there to diagnose your disease, because looking at the protocols of pharmacies, they are not allowed to sell medication out of prescription. You understand? You must bring your prescription part that entails a signature of a prescriber. You understand? That I prescribe this drug for this person and this person should take it. So if you go to the pharmacy, most of them are doing business, because it is business, I can say. Nobody is doing it for voluntary service. You understand? If you go, you give them, you tell them I have common cold, you understand, they give you like amoxicillins and other thing, not knowing the fact that common cold cannot be treated by any antibiotics. You understand?
Okay.
Yes, it is. You only use antibiotics for any when we suspect any bacterial cause. So by going to the pharmacy, they will put you into many antibiotics, which your body can also be resistant for it. Maybe you will not even know. We have different types of antibiotics, different classes of antibiotics. So you must know, the prescriber. That's why they advise you to come to the hospital, because there is someone trained for that. You understand? That person knows the best antibiotic that will work with your complaints. So you go into the pharmacy taking any other antibiotics, means you are creating
another sickness. Well, I will definitely allow to Etano, if you also have any questions that you want to put across for him, you can definitely do that. Well, the number to call is 373-5543. 373-5543 if you wish to be part of the talk show. The number to call is 373-5543 for now. Yes, Etano, if you also have a question, you can put across to him.
Absolutely. Well, thank you very much for coming on the show. That's a really interesting essentially words that you've just told us, so thanks ever so much. One of the things which I'm just querying, and perhaps you could clarify for the listeners as well, is that we have previously interviewed a state registered nurse on the subject of malaria, and just so we get the protocols right here, if you suspect that you have malaria, should you go straight to the hospital? Because my understanding is, and correct me if I'm wrong, but you are also able to go to a pharmacy and actually take a test there. Is that accurate? What if you think that you may have malaria? What is the best course of action for you to take?
Yes. Okay. Having malaria comes with science. You understand? So in the hospital, we treat malaria, but we also treat any other complication factors. Because if you have malaria, you used to have headache. You understand? Most of them used to have fever. So we have two types of malaria. We have the complicated malaria and the uncomplicated malaria. The uncomplicated malaria is they having headache, fever, and other one. But the uncomplicated is one example of cerebral malaria. So you can do the RDT test in the pharmacy, but it is not. You understand? They used to do the RDT, but RDT is not the intensive way to look for malaria. It's just like a strip that they used to put there when they see two lines, they say it is positive.
Positive, yeah.
You understand? But instead, if they don't see that one, they can try the BF method. That is the advantage of going to the hospital. If they suspect malaria, they did the RDT for the first 5 days. You understand? As I'm telling you, because the signs start after 8 days, invading your liver. So if they see to it that they don't notice anything, the RDT is negative, instead they used to do BF, that is the blood film that they use microscopy to look for the intensive examination of the plasmodium. Yes.
Okay, that is a very important. Etano, I hope you are convinced.
Yeah, absolutely. So I think really, you know, from the sounds of it, the best course of action is to go to the hospital.
Yes.
Yeah, and now you talk about complicated and uncomplicated malaria, which is also very serious. We came to realize that complicated malaria is always severe and very serious. Okay, what do you think causes complicated malaria?
Yes.
The number to call is 3735543. Call us and tell us what causes malaria, what causes malaria, and what is malaria. What is malaria? And again, what are the signs and symptoms of malaria? What are the signs and the symptoms of malaria? At least mention 4 of that. And tell us why do most Gambians always love to go to the pharmacy instead of going to the hospital and do their medical checkup. The number to call is 373-5543 for now. Yes, you're welcome.
Yes, looking at from the word complicated and uncomplicated malaria. You know, malaria itself has 5 plasmodium. You understand? We have the Plasmodium falciparum, the ovary, we have the vivax, we have the knowlesi. You understand? So we have different types of Plasmodium. We have 5 types of Plasmodium. So this complicated malaria is caused by the Plasmodium
parasite.
Yeah, the parasite, Flacidium. You understand? Yes, the Flacidium. You understand? So it depends on the protozoa that cause it. You understand? Like the Plasmodium, different types of Plasmodium cause different types of malaria. So the falciparum, falciparum is the one that causes the complicated malaria, and while the Plasmodium malaria is the one that causes the uncomplicated one.
Okay. Now I would love to go from malaria now. I also would love to know this question. Like many of our people, when they are sick, instead of going to the hospital, they will go to these marabouts. And we have heard from different marabouts that says, I can heal this, I can do that.
Yes.
So eventually, most of the people will, their sickness will go, deep. What is your advice to these local people that also go into these herbals medicines?
Okay. Yes, for the herbal medicines, I cannot say they are bad. Some truly works. You understand? So that's why like these agencies are created to look upon them and supervise them. But like I am not also convinced with the fact that having malaria or any other complicated disease, complicated or uncomplicated disease, will take you to a marabout, because there is no scientific proof. You know, if you are too much scientific, you understand, you will not be able to believe the works of marabouts. Though some in our local way, you understand, treatment is given according to your psychological beliefs. Right now, VM, if I give you this water, when you are feeling pain, you understand, I tell you that drink this water, you understand, the pain will stop. Like if you drink this water, there is already a psychology that is created in you that also used to aid in healing, because medication works also according to your own psychology. That's why people believe that when they go to the hospital, they feel okay. Even sometimes some used to come to the hospital, we look, we collect all the vital signs, we see to it that it is normal. We instead do something like placebo. We give them like something that will stimulate their physiological behavior, that they will heal. That is like example of that is counseling. We tell you, okay, now, VM, take this water and drink. You understand? You'll be okay. So by drinking this water, there is already a psychological drama placed in you, so that only will heal your pain. You understand? So these marabouts also, some used to, some.
But do you actually believe in it?
No, I don't actually, because I'm
okay. Now, what I'm gonna do, I want to know a nurse, let's say a doctor, and a marabouts, who is the most fastest? To heal a sickness. Tell us, do you think a marabout or a doctor, who is the fastest healer? Who can, I want to know these questions from the listeners. The number to call is 373-5543. You can also